Okay, so in my PowerPoint presentation, I will be discussing 3 of the possible different nursing certifications that I would like to obtain after I graduate. The 3 that I'm going to talk about is going to be a certified flight registered nurse, a certified aesthetic nurse specialist, and a family nurse practitioner. I will also be discussing how you will be able to obtain these certifications, um, how these certifications would benefit me, and how I think they're beneficial to me in my career. I will be talking about the eligibility requirements and the recertification process for whenever you have to recertify your certification. So the first one I'll be talking about is a certified flight registered nurse. So these are registered nurses who offer critical care in aeromedical situations. So either helicopter or plane or whatever it may be. And they usually do it during air medical transfers. And not only that, but they do these types of they do their work whenever they're going to either accident sites, or they're doing interfacility transfers, or they're showing up to a natural disaster, a natural catastrophe. That is where they would show and enhance their critical care specialty and take care of the patients in those situations. To obtain this type of specialty, you must have a valid and unrestricted registered nurse license wherever you reside. So whether that be Illinois, U.S. territory, Canada, wherever that is, you must have a valid license. Once you determine if you're eligible to take the exam, you will set up a BCEN account. Once that is done, you will fill out an application. Once you fill out that application, you will then submit the application, and then you will pay for the exam. Once that is done, and after your application is getting processed and the full payment is received, the BCEN will send you an email confirming your eligibility for the exam. So some of the details that this email will include will be details about a 90-day test window, how to make your exam appointment with a BCEN test delivery partner, and it also has some helpful study tips on what to do to study for this exam. For this exam, you must choose a delivery mode for the exam. There's 2 different types. The first delivery mode is at a testing center. So you would select a location of the testing center. You would select a date and time for the exam, and then you would select a BCNE or BCEN test delivery provider, and then you would schedule your exam within that 90-day window frame and take your exam. The second mode of delivery is a remote proctor. You must be eligible for the requirements for that, so not everybody's eligible for that. I didn't really go too much into those requirements, but you must be eligible for the live remote proctor exam. But if you do meet those requirements, you will then just have to select a date and time with your online proctor, and you will schedule your exam from there. The next certification that I decided to talk about is a certified aesthetic nurse specialist. So this type of certification is a registered nurse that has specific training and certification to do aesthetic or cosmetic operations that are confirmed by the Plastic Surgical Nursing Certification Board. Nurses in this profession can do things such as injectables, laser treatments, cosmetic procedures, things of that nature. I think it would be, beneficial for me to have this type of certification because it would allow me to gain credibility, different job prospects. It would gain more professional development and ultimately better patient care. I also think this would be something that makes me more competitive having these things, and also more trustworthy in employers and patients' eyes, just having these qualifications. So if you are applying for the first time to get this certification, to receive your CANS certification, which is just certified aesthetic nurse specialist, you have to apply through C-net. And where you would do that is you would go to www.cnetnurse.com, and that's how you would go about doing that. To obtain certification, to get this certification, you must meet these different eligibility requirements before you can even sit for the exam. So again, you must have a processed and valid nursing license, whether that be, wherever you live. You must also have, it's going to be 1,000 hours of practice in the key specialties over the previous 2 years. So, and you must possess at least 2 years of experience working as a registered nurse in these core specialties, alongside a board certified physician in that specialty, whether that be dermatology, ophthalmology, plastics, aesthetic, facial plastic surgery, whatever that may be. This can include working for at least 3 years before applying in a general staff, administration, education role, whatever it may be. But like I said, at the time you must be working with a board certified physician in dermatology, ophthalmology, plastic, aesthetic nursing, or facial plastic surgery. So one of the last things that you have to do before you can even sit for the exam is you have to get your application approved by your supervising core physician. And their license has to be currently, a full license without restriction. If you are trying to get recertified, you must have a current nursing license. Again, it is the same as the original certification eligibility. There are no exceptions. And then you have to have 45 plus contact hours during that 3-year CANS certification period. And then you must have 30 or more of the core specialties. So plastic, anesthetic, ophthalmology, dermatology, again. You also must have 2 or more patient safety hours. And then your hours outside of that 3-year certification will not be accepted. So you want to make sure that you get those hours within the 3-year certification. Lastly, I'm going to be talking about the family nurse practitioner certification. Family nurse practitioners are advanced practicing registered nurses who they specialize in offering patients of all ages, from infant to elderly, and they give them complete primary and preventative care. I would say one of the biggest benefits for me in becoming an FNP is that in most states, FNPs can work autonomously without a doctor's supervision, and they have complete practicing authority, which is something that is really nice. I think that this type of independence would allow me to establish trusting relationships between patients and staff, as well as allow me to make knowledgeable and good clinical judgment based on my experience and the skills that I've acquired within that time. So there are, again, eligibility requirements to obtain this certification. Some of the educational program requirements include a nationally recognized competency of the nurse practitioner role in the population specialties of adult geri, primary care, family across the lifespan, or psychiatric mental health. You must have the APRN core, which is advanced physical assessment, advanced pharmacology, and advanced pathophysiology. For the NP educational program, you also have to have a required number of faculty supervised direct patient care clinical hours, and the maximum amount of hours for that is 500 hours. Some of the other eligibility requirements are, again, you must have a nurse licensure, current valid license of a professional nurse wherever you reside. You must also have an academic transcript that can be sent to a email, which would be aanpcert.org, or you can have it sealed from the school to the registrar to AANPCB. Either way. You will then be able to create an online profile at www.aanpcert.com or .org, sorry. Once you've done that, you will then be able to apply for the exam. Now, recertification requirements, or what you have to do to maintain your certification. So the certification is only good for a maximum of 5 years. So at the conclusion of your 5-year certification, your NP certification expires, and it is the NP's responsibility to renew their certification prior to its expiration time. You can recertify by practice hours and continuing education, or you may recertify by taking a recertification exam. So if you're going to do it by practice hours and continuing your education, you must complete at least 1,000 clinical hours in one or more of these different roles, being administration, research, educator, or direct patient care. And then all of this practice must be done within that 5-year time of the certification. You must also have 100 contact hours for advanced practice continuing education. Now, regarding the recertification exam, prior to the expiration of your certification, you must pass and take the certification exam. This certification exam, for each calendar year, you are only allowed to take the exam twice. So you want to make sure that you have that taken within that year, and you can take it twice. So comparing the 3 different certifications, I believe each certification is beneficial in its own way and would be super beneficial to have. I think the one that would be most effective at professionally impacting healthcare in my area of interest would be the FNP certification, simply because I've always kind of thought about going back to school and getting my NP certification. It's just something I've always thought about doing, and I think doing it in family medicine would be really cool because you get to work with patients of all ages that start from infant to elderly, and you get to provide that primary and preventative care. I just think that increased access to care, better patient outcomes, and increased patient happiness are just some of the few topics that I think I would be able to effectively target in this professional healthcare work that I would be in completing the FNP. Like I said before, I think FNP would be the most beneficial in my professional goals, simply because one of my professional goals I've always thought I would want to do is go and get my NP. So this would probably be something that would be the most beneficial for me. My plan to obtain these certifications would be to obtain the FNP within, 2 years, maybe 4 years, kind of just depending on, how much I enjoy working in the hospital, how much I enjoy the department I'm in. or if I'm ready to move on with my career and start getting to that NP process. I would then choose to apply for an NP program, hopefully one that is close to home here in Illinois. If I can't find one there and I don't get into one close to home, I would then look to apply for an online program, which I know they have. And then, like I said, once I get accepted, I would plan to go into the family nurse practitioner program. In conclusion, though, I think that each one of these certifications would be super cool and beneficial to obtain in their own way. I was able to learn what it takes to obtain each certification and how each certification works. I was able to also learn the whole recertification process. So once I do obtain one of these, I will have better knowledge on how to recertify my certification. Overall, I think the F&P certification is more beneficial in long term and for my future, but something I have always thought about doing is working outside of the hospital setting and not doing bedside as a nurse, and doing aesthetic nursing and being able to do, lip filler and things like that. So I think being an aesthetic nurse would be something that would be super cool that I would really, really enjoy doing as well. And that would just be something, another certification that I kind of have under my belt, in which something I can go back to if I end up wanting to, say the NP route doesn't work out and I don't like that. I can always, have this certification or even recertify myself with this and go back to doing that. That's something that's not necessarily bedside. And that's my presentation.